morning, everyone, and thank you for joining today's call uh, about the social return on investment to understand the cost and community impact of telehealth. We really appreciate you taking the time to join us today, and I want to let you know that feel free to add any questions in the chat button, and our colleague will be from HRTC will be tracking that and share any questions with us if we have time at the end. So just want to introduce ourselves. My name is Yael Harris. I am the CEO of Laurel Health Advisors. We're a small woman-owned business based out of Washington, D.C. And Jason Goldwater is the president and COO of Laurel Health Advisors. So I'm going to start with a quick overview of what social return on investment is. And then Mr. Goldwater will go into details about how this applies to rural areas and telehealth use. So as we all know, telehealth is transforming healthcare. It's making healthcare services more accessible, especially in underserved and remote areas. It reduces travel time, lowers costs, increases access to care, and also directly impacts both physical and mental health by supporting monitoring to prevent complications from chronic disease and increasing access to timely mental health. However, beyond the impact on costs, telehealth also improves the delivery of clinical care by increasing efficiency, reducing wait times, enabling providers to see more patients, and expanding access in places where there are not enough healthcare providers. Traditional return on investment narrowly focuses on the value of investing in telehealth. However, this focus is only on costs. This overlooks the full impact of the investment by not taking into account community level benefits like reducing the factors that contribute to health disparities or improving individuals' productivity and quality of life. Social return on investment captures the broader impact of telehealth by looking at both public health, community well-being, productivity, and its overall impact on society. So what is social ROI? Social return on investment is a framework to measure and understand the social, environmental, and broader community economic value of an intervention. It looks at if the broader intervention, beyond just those that are financial, and looks at a more comprehensive view of benefits to both individuals and to communities. Like traditional return on investment, social ROI looks at multiple benefits like money and resources, but it also considers things that are harder to measure, like community improvements. Part of it is important to engage stakeholders, such as community members, healthcare professionals, patients, and families. These people offer a better understanding of the stakeholders' perspectives and experiences. This is important to understand their needs and expectations. The next step is understanding social and environmental impacts that are assigned a financial value so that outcomes are compared to costs. Social return on investment provides a more comprehensive cost-benefit analysis, reflecting the intervention's true value. It also allows organizations to demonstrate the return on investment in ways that are meaningful to both financial stakeholders as well as non-financial stakeholders. Unlike other financial organization analyses, it's really important to continually monitor and provide feedback and learning from social return on investment to modify and optimize the intervention. So I'm just going to provide some of the core components and then turn this over to Mr. Goldwater. First of all, there's 5 essential components. It's crucial to identify key stakeholders, understand their perspectives, and engage them in the analysis. But the next step is important to develop a theory of change. This involves mapping underlying relationships associated with inputs, activities, outputs, and intended consequences. This helps create a logical framework connecting actions to their anticipated impacts. The third step involves putting a dollar value on the social and environmental outcomes based on the theory of change. This can be done using market prices or methods to measure the financial impact of these individual investments. Attribution involves understanding the unrelated barriers that may have caused the outcomes, while deadweight estimates what they would have happened without this intervention. And finally, you generate a final ratio that compares the value of the benefits created by the initiative to the money invested in it. This measures the social impact generated for every dollar invested. I'm going to turn it now over to Mr. Goldwater to go into details about how this relates to telehealth.
Thanks. Move to the next slide. Thanks so much. So good afternoon, everybody. It's great to be talking with you, and many thanks to Evelyn, Molly, and Haley for this wonderful invitation. We greatly appreciate it. Really, social return on investment has become much more critical and a lot more important in telehealth over these last couple of years. And namely, it's because there's been a lot of analysis around what the cost impact of telehealth is, which got and took on incredible importance during COVID. But there's a lot of benefits of telehealth, which individuals and organizations were having a hard time quantifying, and that was really around the social impact of telehealth. Things such as reductions in travel time, no need to be hiring a babysitter or finding care for an older adult that someone may be taking care of that would eliminate their possibility of receiving in-person care, not having to rely on undependable transportation or the lack of public transportation to get to a in-person visit, and other benefits. So the question that was posed to us some time ago was, well, how exactly do you quantify those benefits and really show value? So social ROI really accounts for the far-reaching benefits of telehealth. It really examines things like improved access, reduced costs, and the overall enhanced health outcomes for individuals and for communities. It validates that investment in virtual care because it provides a data-driven justification for the value and return on investment in these telehealth technologies and services. So an example would be in a case study that we did in Florida, where we were examining people that were on Medicaid that needed to receive oncology care, cancer care, that getting to an appropriate in-person facility would take hours. And given that roughly half of the people in the communities that we were examining did not have a car, they were going to have to take public transportation, which would take almost an entire day just to get to the in-person location to receive treatment, where they would then have to stay overnight and then go back to their house the next day. And this is, of course, while they're ill and receiving chemotherapy or immunotherapy or so forth. So if you want to remove that barrier and make that and understand that in a quantitative sense, then you're really understanding what the value of telehealth is beyond just being convenient in terms of providing care, and rather than going to an in-person appointment. And using this kind of analysis really supports the development of effective policies and reimbursement strategies that promote the adoption and its sustainability. Next slide. So it becomes really clear, or it certainly becomes really important, when we start talking about these value-based care models. So in the last decade, well, really since the onset of the Affordable Care Act, the way that we are examining the outcomes of care is really through these value-based models where we're tying reimbursement to outcomes and to delivery. And there are a number of value-based care models, some that are dealing with very specific conditions like kidney failure or maternal health, and others that are more broad like accountable care communities. But really, social ROI intersects into all of them. It aligns with that CMS triple aim of improving patient experience. So in other words, making it easier for an individual to receive care, improving population health, because if they receive care, then the odds of them having improved outcomes of life is greater, and then reducing per capita costs. And that could be evaluated a number of ways, that by receiving care appropriately and at the right time, and receiving medications appropriately and at the right time, the conditions that they may be facing are not exacerbated as a result of them not receiving care or missing appointments because they're unable to go. And so the cost of healthcare overall are reduced because they're receiving needed care and needed maintenance. It aligns with Medicaid and Medicare goals, and that it helps organizations achieve those goals of most value-based care models, all of which, even if they're broadly focused or narrowly focused, it's really about reducing unnecessary utilization and overall improving outcomes. And it advocates for payment parity. We have heard time and time again, and Yael and I have done numerous evaluations of telehealth over the years, and we will tell you that most of what we hear from providers is that they won't use telehealth if it's not reimbursed in the same way. The reason they're going to it so much is because as of now, reimbursement is equal. There is parity. If you take parity away, then they're not going to really use telehealth anymore. So having a methodology that demonstrates the value of these services and what it does both quantitatively and overall in terms of the benefits to the patient by increasing access, reducing burden in terms of driving or finding a care sitter for their children or older adult, relying on transportation that they may not have, or other factors, losing wages because they work an hourly wage job. When you incorporate all of that into the overall method of return on investment, then you're really understanding how to advocate for these medical and non-medical interventions. Next slide. So one of the examples we're going to give is Telehealth Rocks, which I'm sure a lot of you that are on this call already know. And shout out to Kansas, because this is something we wanted to focus on today. So Telehealth Rocks, an amazing program, has been around for a while. It really expands telehealth services to rural and underserved areas of Kansas. It provides a wide range of healthcare services through telehealth, improves care coordination and patient outcomes, and most importantly, it is supported by the Health Resources and Services Administration, which of course is the major proponent of telehealth everywhere within the United States. Next slide. So the goals of Telehealth Rocks are expanding access to pediatric and behavioral care, providing a convenient and accessible platform for both children and families, delivering care via schools and home, so school-based care and home-based, leveraging them to bring care directly to students and families in their environments that are familiar to them, and then enhancing care coordination, which is not just a primary goal of healthcare, but certainly a primary goal of these value-based care models to improve communication and collaboration between providers, schools, and home caregivers. Leveraging telehealth breaks down these barriers and help support the better well-being of children and families like this program does. Next slide. So what would be the approach if we wanted to examine social return on investment for this program? Now, I'll give a small caveat, which is we're not going to go into all of the financial detail because that would take far too long and we don't have enough time. But we're going to sort of give you an overarching way of how you would go about doing this. And hopefully you can see some of these fundamental elements to apply to your own programs. So you have to combine qualitative and quantitative data to capture the full impact. You're not just looking at cost data. If you're just doing that, then that's just sort of a traditional return on investment model. What you want to look at are not just the costs, but you want to look at patient satisfaction. How is care being coordinated? How many people have reliable transportation to travel to in-person visits? If behavioral health, for example, is a major issue within a region, a county, a city, or so forth, what is the nearest behavioral health care provider that someone would have to go to if they wanted to see an in-person visit? And I know when we did case studies of states like Wisconsin and Arizona, we found that in some of these areas where there was a high concentration of Medicaid beneficiaries, the nearest in-person facility was somewhere 80 to 100 miles away, and that's a one-way trip, and assuming, again, that they have reliable transportation. So you want to be able to incorporate all of that. How many of them are hourly workers? How many of them have young children or an elderly parent they need to take care of? Do they have reliable transportation? Do they have reliable housing? So that way there is some place that they leave and come back to. All of that has to be assessed in order to build this particular model to evaluate sort of telehealth holistically. Identify and measure the outcomes that matter most to the stakeholders. That's not always a dollar sign. That is also how much gas are they saving and not spending on because they're able to leverage um, virtual care? How many wages are they not losing as a result of leveraging telehealth? How satisfied are they with their care? Are they able to get medications refilled on a on a more expeditious manner? These are all things that you want to try to be able to find out. Then it's what is the proxy assignment from public data? Can you leverage existing data sources to assign financial proxies for intangible outcomes? So one of the factors that we have incorporated into our models is the environmental aspect of this, which is if you're not driving to go see an in-person visit, then obviously you're not burning carbon dioxide emissions or things that may lead to or exacerbate global warming. So if we are able to look at data from the EPA and quantify what that means in terms of the financial impact to an area and the financial impact to an individual as a result of the gas that they're not using, then that becomes a tangible benefit of telehealth to include within this model. And then visually represent the steps in conducting this analysis. So it really is, what are all the data sources that you're getting this information from? How are you leveraging this data? And how are you quantifying it in a way that will lead you to a number, but not just an ROI number, but a social ROI number that really indicates that for every dollar you're spending on telehealth, here's what you're getting in return financially and socially. Next slide. So some of the things you may be that are of interest in this model, and there's a variety of them, and this certainly applies to the Telehealth Rocks case study. Fewer ER visits because patients can better manage their conditions. They avoid unnecessary ER trips. As a result, that reduces the per capita cost of care. Less work missed if it's in school-based health, and individuals can receive care within a school. Parents can take fewer days off work to care for their children's health issues. And better attendance. Students miss fewer school days due to improved health outcomes. All of these are goals, many of which have been reached through the Telehealth Rocks program. And these positive outcomes for key stakeholders demonstrate what that impact of that program would be, not just in terms of saved dollars, but the overall social impact as well. Next slide. So telehealth reduces ER visits. We all know this. This has been well established, but it really reduces ER visits, particularly in the state of Kansas, as we noticed for issues around conditions like asthma and mental health issues, largely because they're able to receive care through telehealth in the confines of their school. We looked up some financial data and found out that each avoided ER visit in the state saves about $1,200 per person in medical costs, and that patients were able to receive timely care and avoid costly acute episodes. And that came from a study of a examination rather of national studies, which really showed the higher rates of satisfaction because they were getting care when care was needed. Next slide. Parental productivity. So parents, particularly when it came to school-age children, were able to avoid commuting to and from work, allowing them to have more time at home. With more flexibility in those schedules, they were able to attend to family needs without having to miss work because they were able to receive visits virtually. And the time and cost savings allowed parents to focus more on their work, leading to increased productivity and earning potential. So there was no opportunity cost to factor into this. They were not losing anything as a result of having to take time off for these visits, knowing that these visits could be done in the confines of their house or in the confines of their school. And when you look at what they're not losing, there are a number of studies that indicate what the overall value to an individual or to a family that would be, because they're increasing their earnings, increasing more into the economy, and as a result, making more themselves. Next slide. So if we were to factor all of this in, right, you look at the value created to the overall investment. So if we took the data that we were able to gather, and again, we just simply don't have the time to go into the full blown analysis, but just sort of looking at this in a 100,000 foot view, that the ratio for telehealth rocks is that for every dollar that's put into the program, there's $3.50 in social return that's granted. And what that number overall means is that access to care is increased, better health outcomes, which lead to greater savings in this healthcare system, better productivity from parents, less school days missed, better health outcomes for children, long health outcomes for children. When you factor all of that in and you find the numeric proxies for all of those, then you understand that the value that's created is more than 3 times what you would put into it, which justifies, at least in our way of thinking, of why telehealth needs to be invested into and why there needs to be parity, because there's a greater return on that investment from a large social perspective, in addition to the more traditional ROI model. Next. So the qualitative impacts of the intervention, and again, these are important to factor in, because if you just examine numerically what this is, then you're not really examining the totality of what telehealth provides. It's reduced stress. There's a lot of studies, particularly those in the Telehealth Rocks program, that show that family members reported feeling less overwhelmed and anxious about their children's health needs, largely because they were able to receive health in their school. They expressed greater confidence in managing their child's condition and advocating for their needs, and students showed improved attendance, improved participation, and better academic performance, and you can numerically quantify these. So it had a positive qualitative impact on families and empowered them in a way to help them manage their health better and condition them for success. Next slide. So this is great, but why should I care? Or really, why should policymakers care? And we're now getting to the point where we're in this year where we're going to make decisions about how solid telehealth will be into the future. I think when you do this type of analysis and really work it this way to really consider all of these various factors, you really have a clear story of the impact. You understand and you're illustrating for people how telehealth affects people's lives and communities in a compelling way to help drive legislation. It's one thing to show a bottom line number. It's another thing to show a bottom line number that takes into numerous accounts of what the social impact of telehealth is. It supports legislative change because it provides evidence and policy recommendations that allow policymakers to take concrete steps to address the problem. And it does provide compelling data for budget decisions. If you do this type of analysis, it informs the investment decision that can meaningfully improve outcomes. Because again, if you're getting 3 times the return on every dollar that you're spending and realizing that you're improving patient outcomes, patient satisfaction, providing better health for children, providing greater convenience for families, better care coordination, all of those factored in, really does make a much more compelling story than to say there's a 97% ROI. So policymakers really do have a responsibility, I think, at least, and the aisle thinks, to really tackle these issues and understand how this benefits their constituency and how to make a more compelling argument. Next slide. So you can also use this to really support sustainability of the program. Because again, if you have such a high positive return, then you're ensuring the program can sustain operations and continue to serve the community's needs. It demonstrates the program's ability to meet with performance metrics and comply with reporting requirements, but it also encourages a lot of cross-sector collaboration in that it encourages these diverse partnerships, particularly, if you're looking at older adults that are in a long-term care environment, but providing telehealth within that environment that removes the need for them to have to travel to go see various physicians, specialists, or pharmacies. You can work with all of those various providers to coordinate care and provide care virtually so that the elderly adult is still within their place of residence when they're receiving care. When you focus on this type of sustainability, then organizations can secure the resources that they're going to need. Next slide. And I think really, and Telehealth Rocks is really a great case study for those. That I think when you really examine the social potential, social ROI, the potential, you're really unlocking what telehealth can truly do. It really does reveal its full impact because it shows the assessment of all of telehealth's benefits, not just the financial ones. Improved access, increased equity, enhanced sustainability. The Telehealth Rocks really does provide a replicable model because it does offer a scalable and adaptable model for implementing telehealth programs that prioritize value, equity, and sustainability. And you can use SROI to build more equity-focused systems by leveraging the data you've collected and this analysis. You can understand those pockets and areas within a state or a larger community where there's an equity of care, where they're not getting care because there's limited access or there's barriers to receiving care. And when you design the program around that, then you're addressing these inequities and you're fostering more equitable access. Next slide. So with these advancements in technology, and of course there are advancements in telehealth seemingly monthly, if not shorter than that, there are all kinds of available technologies to really help manage most conditions. Telehealth social return on investment is poised to grow with these advancements and continued adoption. So it really is sort of a vital methodology for understanding the improvement in healthcare access and outcomes as a result of telehealth. As it becomes more widely available and integrated into the healthcare system, the positive impact it can have on underserved and rural communities really will only continue to expand. Next slide. So this is sort of a quote I like. I can't take credit that I came up with it. But let's just stop asking if telehealth is worth it. Let's measure how much it gives back. When you understand everything that goes in to that investment and what you get out of that investment, I think it makes an incredibly compelling and very difficult to argue perspective on the value of telehealth in the long term. Next slide. So you've heard from us, from Yael and I, so we certainly want to hear from you about your case studies or your examples or any questions you may have that we don't get to today. And so I know these slides will be available. So my phone number is listed. You can always call me, but our emails are listed, our LinkedIn page and our web page. So we thank you very much for your time. Thank you for indulging us for this afternoon. We hope we were able to provide some insight, and we are happy to answer whatever questions you might have.
Thank you both for your time and a great presentation. And thank you for kind of demonstrating how you can apply these analyses and methodologies to different programs in our region. I would like to open it up to see if anybody has any questions. We do have a little time, so if you do, maybe raise your hand or come on video, and we can ask them both. I did not see anything specific in the chat. I did see that we had another resource shared, so thank you for that. Are there any questions or comments?
Looks like Wendy has her hand raised.
Oh, thank you.
Hi, thank you. I'm just wondering, is like with this case study, should and I'm kind of listening in on behalf of the providers, so I'm going to bring back the information to them. Is this something that they should start like creating a case study, or is there something that they need to do that they might be prepared for in the future to have like information on hand to say this is, you know, why we benefit from the telehealth visits, or is there something, you know, that they need to be doing now, I guess?
Yeah, that's a great question. So I would tell you that the first thing they need to do is sort of define what they want this case study to be. What I mean by that is rather than say, let's do a case study for our entire practice, which you can do, but that's a large project.
Right.
Is there a case study on a particular condition? Is there something that the practice is using telehealth for more consistently than other areas?
Okay. Kind of like
And
focus in on something that's the most benefit.
that's correct.
Okay.
And then start understanding, and this is probably something that the providers themselves might be able to articulate, or your patients as well. What are the factors that are really important to them? Why do they use telehealth? Um, Understand those access to care issues. Is it because they just can't get to see you in person no matter what, or is it a matter of just convenience? Are they able to coordinate care through the use of telehealth platforms? Is it easier on the patients because, like I said, they don't have to rely on transportation, they don't have to get a caregiver rather, and they don't have to miss work. So there's different benefits for every sort of population. So understand what those benefits are. What are they
Okay.
getting out of telehealth that
All
relate to
right.
that particular case study?
And is
And
this something that might be presented to, I mean, like what would you do with this information? How would you just kind of keep it on the shelf until you might need it? Or are you gathering information to make a case for why we need telehealth? You know what I'm saying? Yeah.
yeah, so that's what Yael and I do. It's to really create a lot of these case studies to make a compelling argument to policymakers about why there needs to be parity. And even if they are hesitating on the federal level, you could still create parity on the state level. So, Arizona is a great example of that. For many years, they have been offering parity between telehealth and in-person care, regardless of what the federal government does. So, if you then have relationships with your payers or with your state legislators, then you can bring these case studies to them to show them what the value is and demonstrate how that value goes just beyond the traditional ROI model.
Okay.
And why it factors into all of these other aspects of care and patient need, and that telehealth beats them. And if telehealth was to go away, which it will not be utilized as much if there's no parity, then these benefits go away with it.
Okay. Thank you.
You're welcome.
Dr. Nelson?
Thank you for the fantastic presentation. I'm just very grateful for our Telehealth Rocks program, that you all really took the whole family view. I think I just wanted to give a shout out for that, because I think it's with that where we see the student and the family that we understand a more impact. My question was a little bit about your experience with social determinants. I think you've helped us kind of think that through some, and how we look at that that value within looking at impact. And then my second question was a little more broad. Um, just as you've had success with these models, is there guidance about how to educate, policy and decision makers? Just anything you might have around guidance about approach with that. And again, thank
Sure.
you for the.
You're welcome. So just to note, Evelyn did not pay me to say to use Telehealth Rocks as a case study. We use that because it's a phenomenal program and does really, I think, highlight the benefit of social ROI analysis. So to your first point, social determinants play a huge role in receiving care. And it really doesn't matter how that care is delivered, whether it's virtually or whether it's in person. But some of those social determinants play a very large role in the ability of an individual to consistently receive care or access care, and to do it in a timely and needed fashion. So the ones that we notice more often are transportation instability, housing instability, are the two that really factor in the most in terms of being able to go and get care when care is needed. And so when you have a virtual environment in which people can receive care through telehealth, then you're mitigating the impact of those social determinants. The other social determinants have an impact on our overall outcomes. So food insecurity, obviously, is going to have a major impact on outcomes of care, even if you're seeing a provider in through a virtual platform. But again, where I think the value of telehealth comes in is being able to coordinate within the community to be able to hopefully provide access to food, particularly nutritious food, in a way that you are again mitigating that. If you see somebody in person, they may give you references to provide. We give you references to go access food, but in telehealth, it is quite possible that that coordination could be done in a virtual room or virtual manner where it's in real time being discussed what they need to do to be able to mitigate what the overall impact of that would be. On the flip side of that, broadband access is a major social determinant now. Some would call it a super determinant of health because if you don't have broadband access, you don't have access to the internet. It's not just healthcare that's suffering. You're pretty much losing a lot by not having access to really the world around you at this point. So broadband access is something that absolutely can impact telehealth availability. So when you are looking about how to expand broadband and to create a better equity, better digital equity in communities to allow them to have the same sort of consistent broadband use you would find in other areas, then that's an important consideration to examine when you are unrolling or unveiling or rolling out, telehealth programs and telehealth platforms so that these individuals in certain areas will have the same access as everybody else does, and then they can receive the benefits. And then you can understand what the social ROI is. The second part of your question, which is, how do you structure, what kind of analysis, and how would you use this to educate policymakers? What we've heard in the times that we have done this is the most common refrain is, I understand that it improves access to care, and I know people don't have to drive and they don't have to take time off work, but really, what does that mean in terms of savings to Medicare or Medicaid? And that was hard initially to sort of quantify that because you're sort of tying in reduction in travel to savings to the Medicaid program when Medicaid may, depending on the state, may or may not reimburse for that travel. But I think what you do overall is when you show if somebody doesn't have to travel and they don't have to rely on either public transportation, which may be inconsistent, or their own transportation, which they may not have, their ability to receive care consistently is enhanced significantly over reliance solely on an in-person visit. And if they then are able to receive care consistently, then adherence to whatever protocols or regimens they have to will overall greatly improve their overall outcome, and then will improve the population outcome. And when you do that, then that's when you start to realize the savings to the program. The savings, the expenses with respect to public insurance, or really any insurance program, generally come to exacerbation of conditions that are not being appropriately managed. So if you're not managing diabetes or not managing cardiovascular conditions, and you're consistently going to the ER and requiring significant treatment as a result, that's a huge expense. That's not to say telehealth will solve all of that. It doesn't solve every problem. But being able to receive care from a specialist or a primary care provider allows you then to at least get the type of care, medication, treatment, care coordination that you would otherwise not be receiving. So the ability to mitigate that exacerbation, which would lead to greater expense, is heightened, and as a result, the program can save money. So that's what we try to tell people, which is you have to look at it from a sort of a long-term perspective. If you do these things, we can quantify how much top gas people save. We can quantify the impact of the environment. We can quantify, patient productivity by not showing lost wages. We can forecast out, what people's earning potential is when they're able to continue working and not take time off. But really what you need to look at is if you factor in all of these elements, then you're greatly reducing the chance of a patient having to go to a provider when their condition has gotten serious enough that it requires an immediate and generally emergency type intervention, which is very costly. And then when they leave the ER, after that condition has been managed, and they don't see a doctor afterwards because they don't have access to one, it is almost a certainty that they're going to be readmitted. And readmissions are the biggest driver of healthcare costs. So if you can manage a way where they're receiving sort of consistent treatment and care, then you're moving to a model where you're reducing the chance of readmission, reducing the chance of emergency intervention. And as a result, the savings to the program would be significant.
I would just also add that a lot of providers have, I have to see if there's been any publications, a lot of providers have pointed out the value of telehealth in addressing social determinants of health. In a private room, asking people questions that make them really uncomfortable, they're less likely to answer. But if they're on the phone with them and you can see things in the background, or you can say, do you have healthy food? Let me see what's in your refrigerator. It really gives you an insight to help make sure you're better managing your patient's social needs. And also from a policy perspective, I want to point out, we did a statewide study in a New England state and spoke to multiple federally qualified health centers. And over again, they told us telehealth has increased the number of types of patients they see. There are a number of patients that typically would not come to care that were using care because of telehealth. But they said because they operate on such a tight margin that if there's no parity, they said they're going to have to start denying those patients telehealth services. And they said, we know those patients are not going to be coming in here. They're just going to be going back to the ED for their acute episodes.
If I may, hi, my name's Serene. I work for Finger Lakes Community Health, a community health center in New York State in the Finger Lakes region. And I would agree with Jason and Ela, what you're saying. So with our telehealth program, we've been doing telehealth since 2008, 2009. I started in 2010. Having those metrics that you're referring to quantify the impact much more than that encounter is so impactful to everybody that's involved. In our organization, we not only provide direct-to-consumer services, but also collaborate with those specialists. We're in rural areas. So having those specialists come in via video to our health centers where we telepresent, use the digital scopes to help support those visits has definitely reduced the time spent to travel to those visits, and we have been able to really measure the impact of that savings on not only the patients as individuals, but as our staff as well. And also to be able to support the patients in a setting where they're able to work with their primary care doctor and their specialist. And that in itself is I think there's a lot more greater ways to quantify the savings in that in the healthcare system than what we're currently doing, because we're able to reduce those emergency room visits or really take advantage of the having providers work at their top of their license, where if it's an established person, the specialist can say, no, primary care, you can manage this. We'll take the harder cases, which allows for more people to access the specialists, and the wait time to get into those specialists is reduced. So there's a lot more savings with the telehealth work. The encounter reimbursement definitely helps. For us as per telepresenters, we do not get the reimbursement does not does not measure up to what the time and energy that we spend with our patients. So totally understand our fellow health centers who say, you know, the reimbursement piece really impacts the capabilities of being able to support the telehealth work and continue that service, because there's that tight margin and being able to support that work. So we're always telling folks, look at what else is out there, what else the needle is moving other than that encounter, because it is able to support the healthcare system and the patients. But at the end of the day, is it helping that individual health center to continue that service? And it's just very hard to do without that reimbursement piece. So I think a lot more work can definitely be done with the legislation component.
Thanks so much for sharing that. That's terrific. Thank you.
Absolutely.
I did have another question come in the chat. Can you share which factors are more challenging to monetize?
Well, environmental health.
Environmental. That's what I was going to say.
Yeah,
Environmental health.
yeah,
Go ahead.
that's a little bit. I mean, you can quantify the amount of admissions that are being released, and you can tie that back to how much gas is being used and what the overall cost would be. But we're still trying to figure out the best way of sort of quantifying what the overall economic impact of the release of X number of admissions would be over the course of, 5 years, 10 years, 15 years. That's a little tricky. Everything else, there's plenty of studies that quantify that amount.
Thank you. Were there any other questions for our presenters? We do have a large group, so if you raise your hand, that does help. Okay, I'm not seeing any additional questions for you. I will turn it over to Haley. Thank you so much for the presentation and great information. I will turn it over to Haley to share upcoming events.
Yes, thank you guys so much for that great presentation. Definitely appreciate all of the conversation afterwards. Let me get my screen shared so we can go through some upcoming events that we have. All right. So yeah, before we wrap up, I just wanted to highlight some of the upcoming events. So on April 17th, Telehealth Rocks will be hosting Matthew Desmond for a conversation on poverty. We will include that registration link for the event in our follow-up email, just in case you all are interested in that. And then we do have 2 upcoming HTRC education series sessions. Those will be on April 24th and April 30th. So be on the lookout for those calendar holds. Today's session was recorded, so we will include the link to that and any additional follow-up materials in that follow-up email once the recording's been processed. If you'd like a certificate for today's session, please email us at htrc@kumc.edu. And thank you all so much for attending. We look forward to seeing you next time.
Thanks, everyone.